Sebelius says the website has cost upwards of $175 million up to this point. But the website is not the only glitch with the Affordable Care Act. Despite promises coming from the president during his push to adopt it, new reports show that at least 2 million people will be dropped from their health insurance and forced into the health care exchanges. And some people locally have just gotten their notices. Matt Markham spoke to a couple of them, now trying to figure out what exactly they need to do. Matt?
Well, they didn't think they'd be dropped at all, Dory, because of the Affordable Care Act, and they're fearful now that coverage may end up being more expensive for them. They're weighing several options now, including whether or not to have any insurance at all. They are insured through their employer now, and they're worried about their jobs as well. So we've agreed not to show their faces, so they'd agree to tell us their story.
I'm concerned that I took this job because of that health care.
So imagine this man's surprise when he received this letter from his insurance company saying his coverage would end with the end of the year. He was placed through a temp agency with a state government job, along with another woman facing the same problem. When you found out that your insurance plan wouldn't be offered to you anymore, did they give you a specific reason as to why?
Because they don't meet the federal requirements.
She can sign up for the exchanges on the New York State of Health website or pay a $95 penalty and have no insurance. What is your plan at this point?
I'm tempted to go without insurance for a while.
Pay the penalty?
Pay the penalty.
There will likely be more coverage offered under the new insurance plans. They are listed on 4 tiers of coverage. While they offer the same set of essential benefits, there will be differences in how much you'll have to pay for the premiums or out-of-pocket expenses.
I don't think most people understand why it's going to be, in some cases more expensive. And again, that's because there's broader coverage and you have a little bit of safer coverage.
Wendy Weller is an associate professor of public health with UAlbany. She says you may be getting more out of your health plan after January 1st, and people kicked off current plans may get some help.
It may look expensive, if you go online and see a plan and it says, oh my gosh, this is how much you have to pay on a yearly basis. But part of that cost may be offset by subsidies.
And they could vary depending on how much you make.
And those subsidies are on a sliding scale, so people with lower incomes have received larger subsidies.